Welcome to my attempt to do a trial search of database. Is the one selected particularly here is Embase, and I'm using the Ovid interface, and I'm going to try and search for the question is about non-steroidal anti-inflammatory drugs and whether or not they delay fracture healing. And I was particularly asked in the question to see if I could limit it to articles related to the emergency department. So that is the brief, and that is what I'm going to try and do. So I'm going to start with the first line of my search. And the first line of my search will be asking for NSAID and then truncated the use of the star for NSAID or NSAIDs or non-steroidal anti-inflammatories considered as a phrase. And I know I've done it as a phrase because I have put the actual keywords into quotation marks at either side. I've also used the star for the truncation of anti-inflammatory, and I've got it down as a single word. And I've asked it to consider non-steroidal anti-inflammatories or NSAIDs in the title and or the abstract of the article. And there we are. There's the results. It's come up 49,649. So that's the first line of the search. Now I'm going to think about the fact that non-steroidal anti-inflammatories may sometimes have a hyphen between the anti and the inflammatory. They sometimes are considered as two words. Now, when you've got a hyphen, the database will treat that hyphen as two words. So you have to type it in either using the hyphen or not, but you have to type it in as a phrase, which is what I'm doing here. And I'm doing an OR search, which is the inclusive one. So I'm asking it to retrieve non-steroidal anti-inflammator with the truncation or and or in the title and or the abstract. And I will click search and it goes away. And as you can see, another 26,000 articles have been retrieved in that fashion. Now, I'm now going to see whether or not there is a subject heading for non-steroidal anti-inflammatories because I want to ensure that my search is as comprehensive, as systematic as possible. So I'm going to search that controlled dictionary of subject headings, and I'm going to ask it to consider the keywords in the widest possible way. So that means that it will consider it as in terms of the tree structure, the broader terms, and also the more specific terms as well. So I've asked it to include all subject headings and to explode it. So it mentions there, use the explode box if you wish to retrieve results using the selected term and all of its more specific terms, i.e. the terms underneath it in the tree structure, and I will click continue. And Ovid will go away and search, and as you can see, I have exploded that. And I have actually got a result that shows that it is 1 million. Ooh, that's a lot, isn't it? Okay. So now I've got 3 lines in my search strategy that consider all the aspects of the actual single first concept, the non-steroidal anti-inflammatories. I now want to go on to search for the second concept, which is the fracture healing. And I'm going to ask it to search for fracture healing or bone healing as phrases, and I'm truncating fracture healing or bone healing in the title, and then I'm going to copy and paste that in as well and ask it to consider it in the abstract. So I have now, hopefully, yes, I've got a combination where you've got fracture heal as a phrase or bone healing. Now, I also want to see if there is a subject heading for fracture healing. So I'll type it in under search tools, and this is the place where you would go to search for subject headings. So I type in fracture healing, and oh yes, there it is. And I want to explode it as I did before, and I also want to include all the subject headings as well. So I'll click continue, and as you can see, I've got 54,000 results with subject headings of fracture healing, which is actually more than I've got with my free text search. So that's worth thinking about, isn't it? I now need to do a search that really captures the emergency ward or emergency department side of things, and I am going to use that search that I mentioned before in the presentation, that line of search. And I've got emergence truncated, I've got the ED or ER or EW or ANE or casualty in the title, and I'm now going to copy and paste them into the field there and ask it to search as the abstract as well. So I've done that, and as you can see, there's a huge amount. I also need to check to see if emergency department is available as a subject heading, and there appears to be one for emergency ward. Oh yes, that's good. Okay, I will now explode it as I did before. Also need to include the subject headings, and I have now searched. Right, at this stage, I've got a search strategy or search history, which is displaying there, which has all of the different concepts considered, but they're not combined together. I now need to combine them. And the way to do that is to do an OR search on all of the individual lines of search that have got the concepts in common. And I'm going to combine all my lines of search on non-steroidal anti-inflammatories. And as you can see, it's a huge result. I'm using the OR search, I'm using the inclusive one. Now I'm going to combine my results using my bone healing or fracture healing results. And as you can see, again, I do have a very large amount, not quite as much maybe as I did with the previous one, but it's a great deal. Okay, and finally, I'm going to combine my concepts around emergency wards. I'm just having a think. I actually just had a think about the word emergency, because the word emergency, actually, it is possible that it might be included somewhere in the title of the journal rather than the actual article. So I'm going to make allowance for that. I'm going to now truncate emergence as emergency or emergencies, and I'm going to ask it journal word to retrieve that within the actual keyword in the title of the journal, which indeed it has done. So now I've done that, I'm now going to combine all my different variations on emergency, so that's my subject headings and also my keywords in the title and abstract, along with the keyword emergence somewhere in the title of the journal itself. So what does that do? Oh, that's brought up a lot, hasn't it? Right. Now, I've all together the variations on all of the different concepts, but I now need to do an AND search to bring them all together to retrieve the small number of results that's got everything in common. So I need results that combine the non-steroidal anti-inflammatories, the fracture healing, and the keyword emergency somewhere. So I'm going to do an AND search, and that's the exclusive one. And I've done that, and lo and behold, I've got precisely 45 results. So look at that. All of those huge results with the OR search are reduced to 45 with the ANDing. So you've gone from very, very broad, not very relevant, to much more sharper, a much smaller amount of results. Let's hope that some of them are relevant. Let's have a look. Oh, yes, I like number 1. That looks interesting. And it's a recent article in a journal to do with orthopedics. And if you look, you see the keywords are coming up. So that one is not relevant, or that one. That one is to do with rats. That's because we could have placed on the actual results a limit of humans only. That's something we haven't done yet. We haven't placed on any limits. The reason for that is one, time, and two is because the limits themselves would reduce the number of journal articles. Because there were so few to start with, I wanted to keep it fairly small. Now, I've just seen number 6 and number 7 while I've been talking. Those two look quite good. They're only notes, but they may contain references that are relevant, and they're from 2020, and they're from a good journal called the Annals of Emergency Medicine. Now, we're just going through again and again, and we do have a problem with relevance. That one, although it's about opioids, does mention non-steroidal anti-inflammatory drugs and might be of interest. So let's carry on. And I'll just get rid of that and just carry on. And we can see that one's to do with children. That might be of interest. And that one, although it's a conference abstract, so it will be a very short communication of 1 paragraph only, would be of interest. And then we just carry on. Now, if you notice, we're going back in time now, so it might be that we may have a cutoff, and if we restricted the number of articles retrieved by date, same to the last 10 years, we might actually reduce the number of articles. But I want to keep this broad because we're not getting a huge amount of results. And oh, here's a great long one, and it goes on and on and on, because I have had to look at this before, and it carries on, it carries on, it carries on, it carries on. And eventually, at the bottom, we have some more. Now, that one might be of interest, although it's to do with pediatric scoliosis surgery, but it might be of peripheral interest, so I'm selecting it. This one looks good because it says do non-steroidal anti-inflammatory drugs cause a delay in fracture healing, but it is old, so it should be used with caution. And then finally, I'm just carrying on. There was a duplicate from a previous one I've just selected, and I've finally got through, and I will now email those to myself. And as you can see, I've selected 8, and I will ask for the citation and abstract and send myself an email. And I can also, as a result, I can click keep selected, and that will actually add them to my search history, which I can save and rerun at a later date, and rerun some of it on a different database. And if you're wondering which ones they were, there they are. So number 1, number 2, number 3, the number 4, which is not specifically on the subject, but has some relevance. Then there's also some to do with children. And then finally, there's mention of something in surgery. And then also right at the bottom, that old one. Now, obviously, if you were going through, you would need to actually strip some of this out, but I've just done, this is a quick search just to show you one approach using a search strategy, using truncation and other things. Anyway, I'm now going to stop sharing, and thank you for listening. And I'm not going to talk anymore because there's lots and lots that you would need to know. But if you did want to have some training on searching, then I would really strongly suggest contacting your local library, and we can do a concentrated searching session with you.